My name's Sam Garg. I'm from the University of California, Irvine at the Gavin Herbert Eye Institute, where I'm medical director and vice chair of clinical ophthalmology. I first got involved in the CentraSight treatment program in the year 2010 when the device received FDA approval, and since then have been implanting the device. I wanted to get involved in the CentraSight treatment program because of its unique nature. It's a very powerful device for patients with macular degeneration, especially end-stage macular degeneration. The role of the anterior segment surgeon is part of the team, and as an anterior segment surgeon, we evaluate the health of the eye, make sure that the patient has a suitable eye from an anterior segment perspective, and then work with the other parts of the team to see if the patient would be a suitable candidate for implantation. As the implanting surgeon, I go over many of the parameters to make sure that the eye is suitable for the device, as well as going over the surgical risks and expectations with the patient. Although AMD is a retinal disease, this device is conquered with a team approach, and we have the implanting surgeon, the corneal surgeon, the retinal specialist who's managing the macular degeneration, as well as the low vision specialist who helps the patient with the preoperative and postoperative evaluation and rehabilitation once they get the device implanted. A good surgical candidate for the IMT is a patient who has bilateral end-stage macular disease, is phakic, meaning they have not had cataract surgery, and is willing and able to complete the preoperative and postoperative rehabilitation. The preoperative procedure is very similar to cataract surgery, although this is not a cataract surgery. The preoperative procedure is similar. Generally, the surgery takes about an hour. It's done on an outpatient basis, and the patient goes home the same day, comes back the next day for a postoperative check. Then afterwards, they work with the implanting surgeon, their retinal specialist, as well as the low vision rehabilitation specialist to start to use the device. The device is generally implanted into one eye, and this eye becomes their eye for central vision, and the fellow eye becomes their dominant eye for peripheral vision. After implantation, the patient needs to get used to their new visual status in their eyes, using one eye for central vision, the other eye for peripheral vision, and this takes them getting used to, so they work very closely with the vision rehabilitation specialist to get used to their new visual status. The telescope itself is a very effective means for improving vision. I like to think about the data in terms of functional improvement rather than numerical improvement. And so even though there was a statistically significant improvement in their vision from a vision standpoint, the more important factor in my mind was their sense of independence and ability to care for themselves better, enjoy life more. And that's really, I think, the goal for this telescope. Patients can expect to see improvement in their vision within a few months after surgery. They need to be advised that this is not a quick fix on their vision, and it does take some time to get used to their new visual status. So I think this is an important consideration in speaking to them about the risk, benefits, and alternatives of the procedure. After implanting a few of these devices, it was clear that the patients are very happy with their new visual status. One of my happiest patients was a gentleman who came to me who had end-stage macular degeneration and was not able to watch TV and enjoy watching baseball. A few months after surgery, which happened to coincide with the beginning of baseball season, he was able to watch his team throughout the season. One of the biggest improvements that patients have reported with this is an overall sense of improved ability to connect. So they're able to get back to their life a little more normally because of their improved vision. And so patients have reported being able to watch sports more, or being able to see their grandson's face, being able to walk around and feel safer in their own home. It gives them a sense of independence that they had lost because of their degrading vision.